Excuse me, I didn't mean to start. I'm going to go ahead and call the Health Committee to order, please. Let's all stand. Mr. Skinner, would you lead us in the prayer, please?
Holy Father God, thank you for the opportunity for this day, Lord, to come to this meeting here for the service of the people that we represent. And Holy Father, we just ask now for thy blessing be upon the chairperson, the council, and the administrators. And Lord, as we go on through this meeting here, Lord, the things that we choose would be agreeable with you, and Lord, and things that we choose to do, Lord, that will benefit others, no profit to myself. And Lord, we ask thy blessing be upon each and every one that is present here this day. And all things that we do will be thanking you at all times. In the name of Jesus, we give thanks. Amen.
Thank you, John. Next, we'll have roll call.
Joe Crittenden.
Here.
Linda O'Leary. Bill Anglin.
Here.
Bill John Baker.
Here.
Jack Baker.
Here.
Audra Connor.
Here.
Meredith Fraley. Chuck Hoskins. Taylor King. John Keener. Jackie Bob Martin. Melvina Shophouse. David Thornton. Carol Cowan Watts. Phyllis Yargin.
Mr. Chairman,
Mr. Baker.
if we could, I believe Chuck is off this committee
that's right.
at this time.
Mr. Chairman,
Yes, Mr.
I'd
Carter.
be part of this committee also.
Oh, we always leave you off
Well,
for
he's
some
down here
reason.
by staff visitors.
I'm sorry.
Young Garvin.
Yeah.
Yeah, I got him at the bottom. I'll put him in the check.
Put him in Chuck's deal. Chuck's
I'm
not.
doing that.
Well, we're glad to have you, sir.
I got him at the bottom, and believe me.
We do have a quorum.
Yes, we do.
All right, we have a quorum. Next on the agenda is the approval of the April 17th minutes.
So moved.
Second. Have a motion and a second. All in favor, aye? Aye. Minutes are approved. Reports. Standing in for Jim is, for the Claremore Service Unit, is Vicki Snell, I believe. Welcome, ma'am.
Thank you. Just going to update you on some of the things that are going on at Claremore right now. Jim's probably kept you informed that we've had a project going on the past 9 months and it's finally completed. Housekeeping is moving in this very week and they will vacate space by our emergency room, and we're going to do a redesign on that space to enhance the emergency room. We're going to be looking at some safety issues there, making it a little more patient-friendly, customer-friendly there, maybe putting a waiting room on that side because after hours people are having to walk all the way through the hospital to sit. So there's a lot of issues we want to look at there and redesign and utilize that space effectively. We're transitioning and continue to work on closing out as much business as we can before we transition to our new finance system. It's keeping us very busy. Our procurement people as well as our finance people are having to close out as much business as they can before we transfer over to the new system. Go live date is October 15th, and we're trying to make provisions for health services so there won't be anything delayed or cut off. There's a lot of issues that we need to address there, and so it's keeping everybody pretty busy and working on that. We have a new contract specialist that has joined our organization. This is a first position of its kind for Claremore. She comes to us from headquarters. She's very knowledgeable in procurement law, and we're very fortunate to have her. She'll be handling all of our contracts and procurement activities for our service unit. And she reported May 7th, and her name is Yolanda Reyna. And like I said, she comes from headquarters. We're about to complete our second room of digital radiography. We've installed one. The second room is being leased from GE, and we should have that room up and running by June 1st. We also have set aside some third-party dollars this year. Our big purchase, and leadership had many things to consider, but we went ahead and we're going to allocate funds to purchase an automated pharmacy system. The number one thing that we're going after is a faster turnaround for prescriptions. So it's like a robotics type of system. And, we continue to look at that. That's, one of the top suggestions we get from our patients is to look at our turnaround time. So we're going to invest some dollars there and install and hopefully see some improvement in that arena. Also, the other issue is that insurance companies are denying our point of service claims because we don't dispense, 30 days. So this will also enable us to dispense and be paid for a lot of the prescriptions we're now being denied for. So a couple of big issues there that we considered and put forth the dollars to. CHS, Jim probably informed you that we have a new case manager, Teresa Payne. This year we have submitted 22 catastrophic cases for possible additional funding for high cost, high dollar cases. So we haven't heard yet if all of those will be approved, but that's a much improvement over our past year's performance there. We also have, an advisory board in the Claremore Service Unit. I'd just like to announce that Kara has been graciously nominated and accepted as our new chairperson of our advisory board chairperson. Do you have any questions?
On the surgeon, I've had a lot of people ask if they had appointments there, is there a surgeon?
Yeah, we had a surgeon that left, and we had a vacancy. So just this week, we have 2 that have started on contract. So we're back up to 3.
So if they can call for appointments?
Yeah, they can call back in. I don't know how soon the waiting list is, but yeah, they've been trying to make arrangements for folks because they did have to cancel some appointments, but we do have some coverage there again now. And we also have a new hire expected in that department in the summer.
Was it nice to be so there?
That's OB-GYN.
No, we didn't.
Yeah, Dr. Nicholson is the one that left, yeah. He went to the VA, and he's going to be teaching in that capacity. So
I had a couple of people that had, appointments and everything.
Yeah, there was some appointments canceled, but we've got some contract staff going now, so hopefully we'll get those folks worked back in.
Okay. Thanks.
Other questions? Vicki, thank you. That was a good report.
Thank you.
Next, we have the Hastings Indian Medical Center, and we have Dr. Ferris.
Hello,
Welcome,
everyone.
Doctor.
Thank you for letting me present. If I appear ignorant, it's probably because I am. Mr. Barrick and Mr. McLemore and Mr. Thornburg are also on a website going through UFMS right now. I'll have to take the remedial course with my husband because he missed his education in that last week. So that is something that's that's going to take over arms for our supply chain, and it has effects of supplies at our hospital, but I think we have various people trying to correct the situation so the supply chain, keeps on going, because our doctors at Hastings do not want this to interrupt patient care. Our PT and diabetic building is going up. We've been having various meetings to assure that the equipment is placed. We also have a committee that's actively seeking ADA recognition, and we're trying to assure that the dietitians and the nurses all have their CDEs or their certified diabetic education. So when we hit the door, we can start billing, because we need to bill in order to make money and revenue so that we can build the second portion of that, which would really, is really the diabetes part of the building. It's really, we're kind of squeezing diabetes, the diabetic program, into the physical therapy department, and but I think it's going to give efforts for people to exercise there, as well as wound care and podiatry. Currently, we will be having a new internal medicine doctor starting in June. His name is Dr. Seth Yandel. We have a doctor, we actually have a panel for an ER physician to replace one that left several months ago. But we are contracting him for a month to make sure that he is someone we want to, who delivers good care to our patients. And then if he works out, then we'll send the panel up. I'm going to ask for an extension on that panel until we make sure he fits in with the rest of the group. I'm still actively recruiting an internal medicine doctor and a surgeon. And we have one of our urgent care doctors quit, but we have another mid-level provider that wants to step in his place and also wants to be hired full-time at our institution. I think, that our collections for the month of April were $2,928,729. Actually, that was $728.93. I just rounded it out. You'll see some things in our booklet here, but I think what's important is the acquisition news, and I think Claremore kind of went through that there were deadlines that we had to meet for certain contracts and orders so that we can keep the hospital running, just so that we can be ready when UFMS goes live, I guess you would say, on October 15th. And you can see a picture of our building going up in here too. Our employee activities. Nurses Week was last week. They show the cake being given by administration, but the medical staff also gave a nice dinner for them at noon. And Dr. Anna Miller usually does a really great job with that. And the rest is just general information that they put in here concerning Indian health. And I think a lot of you guys realize, are not ignorant of these statistics. I think they've been presented to you before, but it's just for your information. Does anybody have any questions concerning Hastings or problems that I might be able to explain, or?
Any questions at this point?
Okay, thank you.
Thank you, Dr. Parrish. Next, we have Cherokee Nation Health Services with Melissa Gower.
Good afternoon.
Welcome.
In April, Cherokee Health Partners performed 128 procedures with an estimated net gain of $53,466. I have great news today. We have successfully recruited and hired a medical director for our PACE program. who is a geriatrician. So I'm really excited about that. I didn't think we were going to be able to, I thought the expectation of hiring a geriatrician was going to be one that we may not be able to accomplish, but we did accomplish it, and I'm very excited, and it's a great asset for our PACE program. So I'm excited. We are continuing to work with Cherokee Nation businesses on health business development ideas, and continuing to meeting with University of Oklahoma on the development of our diabetes and cancer partnership. May the 21st through the 25th is National EMS Week. And if you all get a chance to stop by the EMS building and tell the staff what a wonderful job they're doing, please do that. They're having a luncheon for the staff on Monday, May 21st at the EMS building, and you're more than welcome to stop by and give appreciation to them for National EMS Week. For the month of April, we scanned over 200,000 documents. We continue to do that on a regular basis to try to get all of our previous documents into electronic format, have them scanned so that they're available. Our construction projects are moving forward. They're Salisaw is actually finished. We've had an issue with the concrete flooring and are in the process of rectifying that, so we should be scheduling grand opening very soon there. No water is looking like the end of the summer, probably July, August time frame, so it's moving forward and looking good. And Muskogee is on target still for substantial completion in August. There's lots of transition things that we're working on those facilities to transition from one facility to another, and we are starting to have regular meetings on that transition to make sure things flow well. Our art and equipment for those projects, most of the art and stuff has been selected and is at the framing art gallery being framed, so we're excited about that and think that's going to bring a real asset to those programs. We are continuing in our information technology projects with the electronic health record. We've hired what the industry calls our CAC, which is a clinical applications coordinator. I have really no idea what that person does except that they implement EHR. So, but I've got the people that know what they do. But that was a feat because it was kind of hard to recruit that person. So we have that person on board now and moving forward on the implementation of that. We've been working with, in the recruitment of an OB physician that we've been working with to work part-time at Muskogee. We have an employment agreement finalized with a new podiatrist to start for Muskogee. Has a tentative start date of July 9th. You all may or may not know that I don't have operational dollars yet for Muskogee and are still in negotiation process with IHS. Did that for about 3 days last week and still don't have it, but hopefully we'll have it soon, or we're going to have some issues. So anyway, we're already recruiting people and have people ready to start. We had 2 mid-levels who have resigned over the last month, one at Jay and one at Stillwell. We do have a letter of intent with the physician for Stillwell to start in July, and also a letter of intent for a physician to start at Salina in July, and a pharmacist for Stillwell Clinic to start in July. So we are filling some of our open positions, and we're excited about that. We had, for our diabetes prevention program, we've had 2 community screenings, one at Cave Springs and one at Dahlonega. We had 43 people that participated. with 17 of those after the screening process that are eligible for the program. We met with the Housing Authority to implement the diabetes prevention program there, and they're very open and excited about that, so hopefully that will be successful. And also our Tahlequah CNI offices are interested in that program also. I don't know if you're familiar with GPRA, but it's the Government Performance Results Act that the government, kind of like a scorecard, evaluates their progress. And we track our GPRA and submit that to Indian Health Service also. And every single GPRA indicator we had, which was already pretty good, improved in the third quarter. So we're excited about that. And QI is ecstatic about that because they work on that all the time. Our dietitians have some weight management classes going. Right now we have 73 participants in our weight management classes, which is really good. We've approved and reviewed 2 IRB submittals for the month of April. And at No Water, Bartlesville, and Bonita, our clinic administrator there has, in the month of April, attended several community activities. One of those was the 28th, he facilitated actually the meeting for the 28th Annual Bonita Chamber of Commerce Cafe as chairman. And actually met with a group from Bonita about the old courthouse there and if that could be a possible site for some of our health activities. And then attended and staffed several other meetings, an autism meeting, a No Water citywide cleanup day, food by mailbox program, and a volunteer driver for the No Water ambulance and Angel Food distributor. So we also have a new medical director at Jay. Dr. Randy Underwood is now on staff there full-time as the medical director. Our WINGS program, we had a little over 1,300 active members for the month. We had several activities, about 10 activities with lots of participants, all the way from a walk at Mosley School with 354 people, down to an elders thing that we had in Greasy with 8 participants. We had something in Dry Creek, Mays County Head Start, Bonita, and Bartlesville fitness presentation. We had a stickball at Marietta Boys and Girls Club with 111 participants. So we did the flower run in Muskogee. We had lots of activities. Also in your packet, I've included a couple things for you. One is their Healthy Nations had given me copies of ads that ran in the local newspapers, and I included those because some of those areas are your areas, and I thought you might either haven't seen the ad, or if you have, you might have questions, but it actually has the dates on when some of the WINGS events are in that area for the month of May and some upcoming events. So this is part of our social marketing campaign for STAPS, and we're running these ads in the local newspapers now. So I've included that. The second thing I included is the day camps that schools submitted proposals to have. We're letting the schools actually do that this year instead of us doing that. And this is a list of the, I think it's 17 schools that submitted proposals to do that. So it's the camps, what schools they are, and the contact person and the dates for those camps. So I thought you might be interested in that also. And Audra, I got your registration turned in yesterday. Our tobacco control and prevention program, we have 6 courses with 31 participants for smoking cessation going on. We have 12 active SWAT teams in Adair, Cherokee, and Mays counties going. We conducted youth risk behavioral health surveys in 4 area schools. And I think I passed something out last time, but our residential camps are scheduled for the last 2 weeks of May. With Compassion Capital, we've participated in several of their community meetings, one at Muldrow, one at Oak Hill, and one at Sequoia in Cherokee County. Our public health nursing made about 175 home visits this year, and our EMS program had over 330 calls. Jack Brown currently has 19 census of 19 students there, and our behavioral health staff saw almost 4,900 patients. And the announcement is that you all probably remember that we entered into a partnership with Career Services and did a dental assistant training program in partnership with the VOTEC, because we were having a hard time recruiting dental assistants, and decided to offer that training ourselves. And they do orientation in our clinics. And the dental assistant training program will complete their internships on May 10th at our facilities. They're scheduled to graduate on Thursday, May 17th at 1 o'clock in the Indian Capital VOTEC. And then our next class is scheduled to start on June 18th and run through November 15th. So we'll send another flyer out in May with that deadline. So if you know anyone that's interested in becoming a dental assistant and being involved in that program, please let us know, because it's a great program. Also, the Oklahoma City area every year has award recipients for the Area Directors Awards. Cherokee Nation won several of the peer recognition awards. One of those was Lillian K. Johngrove, who is a behavioral health clinician supervisor at Bartlesville Clinic. Jamie Clark is a community health representative at Claremore Hospital in the public health nursing department. Richard Soldier is a lead clinic caretaker at J Clinic. Carla Keem is a patient benefit advocate at Muskogee Clinic. Brandy Marquez is an LPN at Nowata. Kendra Morgan is a clinic caretaker at Salina. Terry Ross, a clinic caretaker at Salisaw Clinic. Nita Cochran is at Wilma P. Mankiller Health Center. And Amy Hicks is a patient benefit advocate at Bonita Clinic. So those were some of the Cherokee Nation people that won awards, and they'll be in the there's an awards ceremony in July in Oklahoma City to honor those people. So we felt very good that we had several people in that peer recognition award. Also, a merit award. We had one, Kim Osborne at the Muskogee Clinic received that. And I think that's all for Cherokee Nation. So that was a lot. So we're proud of that. For contract health services, for the month of April, we processed 1,490 referrals, approved 1,302, and denied 188. And your charts are in your packets. Our revenue is looking good for the year. If we stay on the projection that we're going, we'll increase our revenue this fiscal year, and so we're excited about that. I also attached a health policy update in your packet, which is a paper that shows you all the state and national initiatives, policy and legislative-wise, that we're working on. Again, if any of you are interested in assisting in any of those endeavors, if you'll let me know, we'll be sure and include you in that, and it gives you an update. And Mr. Crittenden, that's all I have.
Mr. Baker?
The note this thing, asking for additional funds for contract help and such. Have you passed that out, or was that finance? Or?
I was.
Item 2.
That's item 2 on the agenda.
On our agenda.
Oh, okay.
But
It's Jack Baker.
I don't know that it's been passed out. I know Jack had
It has
one.
not. I have not passed it out,
But
no.
we can get some copies made.
I need an agenda.
I've got copies here.
I need an agenda. I left my truck, my book in the truck.
Okay. Other questions for Melissa while we're looking here?
Thank you.
Okay, thank you, Melissa. Good report. Seeing no old business, we'll move on to new business. This is a resolution, a proposal to continue the funding for the Cherokee Nation Cancer Registry. And I suppose that would be, all right. I wasn't sure if it was Melissa or someone else.
I'm going to yield my time to Kim Cravat, who is the director of our cancer programs.
Okay. Mr. Martin?
I will move for approval, Mr. Chair.
Second.
Discussion on.
Kim, you're welcome to our meeting, and they like it already, I suppose. I have a motion and a second to approve it. Any other comments or discussion before we call for the question? All those in favor, aye?
Aye.
All those opposed, same sign. Congratulations. Now moving to item 2, this is a contract health issue, a discussion and possible action. Mr. Baker?
Yeah, Mr. Chairman, I assume she's going to pass these out there.
Point of order. Would it not be appropriate for the person that has the item to discuss first and introduce it?
Mr. Chairman, I have the floor.
Okay.
Like
Point of order.
Point of order, and I just asked for clarification. Would it not be more appropriate for him to introduce it
What were you going to
first?
say? You need to pass the copies out?
I was asking if everybody had copies, and then I was going to speak to it, and I think I
How
have
can you
the
speak
floor.
to somebody else's agenda item though first?
Well, I'm quite capable, and she handed it to me, so I assume I haven't used it for a while yet. And it's right on track with some legislation that I have coming forward.
I'm sorry, but who sponsored this? Was it not Mr. Jack Baker, the Councilman
I
Jack
have
Baker?
no earthly idea.
Doesn't say on there.
It doesn't say. It says the chair, and Melissa handed it to me.
And this doesn't have anything about that either. What?
Yeah, but I called you and told you that Jack was on that.
Right. Jack had requested it be put on the agenda.
Then I'll yield.
Okay. Mr. Baker?
Okay, yes. I asked Ms. Gower to go through and list her needs for contract health services for this fiscal year. And I would like to yield to Melissa to present those.
Okay. And Melissa, do you have copies of this? Okay.
Mr. Baker caught me yesterday when I was over here for executive and finance and said, would you look to see what your 07 needs are in contract health services? And I said yes. So I did this morning and gave Mr. Critton a copy when I got over here for health committee.
And Mr. Baker, nor I, or anyone else had seen this prior to just a little bit ago. So.
That's correct. I
Yeah.
already prepared it this morning.
Okay.
Yes. And this is only a response to the request I got, which was to provide information on the 07 contract health needs, and it's pretty self-explanatory. We've assessed our needs in contract health services for the remainder of 07. For medical needs, $2 million, which would be used for expanded ophthalmology services, orthopedics, back and neck pain, diagnostic testing, emergency room call-ins and such. And then, which is pretty much level 7s and 8s. And then contract health service eyeglasses, $50,000, and contract health services dental, $150,000, which is for pediatric dentistry, wisdom teeth procedures, and biopsies and follow-up of lesions. That's all I have.
Okay. Mr. Chairman, I move that we approve $2,200,000 additional funds for contract health service this fiscal year.
Second. Have a motion and a second. Any discussion? And I've got two hands, Mr. Baker. I think you were first.
Yeah. I don't think the 2.2 is enough. The policy apparently has just changed on the eyeglasses to where we've got elders out there that have been not buying glasses because they've been having to pay $200 out of their pocket. And just recently, they changed the policy where those elders will only have to pay $25. And as soon as our elders find out that they're not going to have to come up with $200 or $250 out of their pocket, I think we're going to see a great need for these eyeglasses. This is not only for our elders, but it's for our children. Anybody that's 185% of property. So I would offer a friendly amendment of raising the eyeglasses from $50,000 to $250,000, and contract health services. We obviously didn't override a veto last night. I would like to add caps and denture repairs to the contract health dental needs and raise that up to $250,000, making a total request of $2.5 million. And God willing, we can get that out to our people. I would make that in the form of a friendly amendment.
Okay, I'll accept it.
Thank you.
I have another comment from Mel Bynum over here, I believe.
Oh. I just had a thought. God forgive me for thinking it.
Oh, okay.
Political people we are.
Did you have something, David?
Yeah, did that include cabs?
I did throw caps.
You throw caps in.
Being that?
It's only for the rest of this fiscal year, which is really only 3.5 months.
And Mr. Baker, you accepted the friendly amendment?
Yes.
And the second also? Karen?
It wasn't me, it was
You
Bill,
know
but
me.
I'm confused on, what is the funding?
What is the funding?
You said 150,000 additional to what we see on the sheet for glasses.
Yeah, they bring the glasses up to $250 and $100,000 additional for dental needs, bringing it up to $250 for a total of $2.5.
It'd be 245.
I don't believe so. It's
250,000.
It's $2,500,000 with the additions, with the 150 and the 100.
Okay, you said an
2 million
additional?
on the top line, 250 on the second line, 250 on the third line. That's
Okay, so an additional
2.5.
200,000 for eyeglasses.
And an additional 100,000.
Melissa? Oh, I'm sorry.
Before I accept the friendly amendment, I'd like to hear from Melissa, because I think there was some thought put into this instead of just throwing money out there, you know, without knowing. I mean, because we're just, you know, I'd like to know if this is for true, you know, for sure this is what, and I really don't need any comment from the group here. This is, I just want to make sure that this money is going to go in the right direction.
Mr. Baker is correct on the policy for eyeglasses, and I have told you all that. Probably, I don't know, I'm not good with time, but it's been at least a couple of months ago when there was some concerns raised about eyeglasses. I went back and looked at our policy, and indeed, our eyeglass policy was much more restrictive than our other, like medical equipment and those types of policies. And I'm sure the reason for that was when the eyeglass program was one of the very first programs that was done many, many years ago, and at that time I'm sure there was a much more need for restriction. So I have changed that policy to be consistent with all of our other medical equipment type denture policies, and so it is consistent, and that's why I was asking for $50,000 more dollars. Can we spend $250,000? I have no idea. You know, I mean, we can spend what we can spend, and if we don't spend it all, there's a carryover, I suppose, or whatever, I don't know, for '07. Because in reality, by the time this gets approved, it would be June council meeting, so, you know, it's going to be available to me toward the end of June, which makes it pretty tight for contract health to get stuff through the system and obligated, so I don't know that. But the CHS dental needs, currently we have a contract health services dental program, and that program is to to be able to refer these types of services, which are wisdom teeth procedures, to oral surgeons, biopsies of lesions and follow-up treatment on that, and also Head Start children to pediatric dentistry, and that's what we use that for. I talked to Dr. Hacker, and he said we're, running a little bit low there, and so he thinks we could utilize $150,000 more through this year to get us through to that. Now, I think that what I wanted to speak to, and I'm not going to say anything I haven't said before, but is I think that the intent was to expand that program to add crowns, and I'm not supportive of that at this time. That's just my opinion, and the reason is because I don't have capacity to operate that program right now. I will have as soon as Muskogee's opened. I have 4 dentists that's ready to start to work at Muskogee as soon as I get the money and put them on, and we have every intention of expanding the dental program there. So that's my comments. Thank you.
Mr. Chairman,
Mr. Carr?
I think Mr. Baker raised contract health by $200,000 up to $250,000, right?
It was contract for eyeglasses was from $50 to $250, and dental services was from $150 to $250.
Okay, so that's $300,000.
Overall?
Yes, overall, yes.
So the total now will be $2,300,000.
500. It was 2.2 to start with.
I know you're raising it 300, so now it'll be $2,300,000.
$2,500,000.
Yeah, 500.
It was $2,200,000 to start with, and we've added 3 to it. 300,000.
Oh, I was looking at the top. It
I
said
understand.
2 million. That's
Yeah.
all of it.
Yeah.
Okay, I said, thank you.
Okay, I had a friendly amendment. Mr. Baker accepted. Buell had not yet.
I'll accept it.
You accept it? Thank you, sir.
I just want, my whole thought is I want to hear it from the people that
Right.
administer. I'm not playing doctor in here.
Okay,
And I just want to hear it from these people, and I heard
good.
that's what I wanted to hear.
Any other comments before we
Mr.
vote?
Chairman, call for question.
Call for the question. All right. Do we need the motion again, or is everybody clear on it? Huh? All in favor, aye? Aye. Opposed, same sign. Okay. Thank you very much. That'll go to executive and finance and full council. No announcements. Next date is scheduled for June the 12th at 1 p.m. I'll entertain a motion to adjourn.
Second.
All in favor? We're out of here. What's my deal?
I got it away from you. Play